Elsewhere, Medical Services Minister Professor Anyang Nyong'o now says government cannot invest more money in health and that the realization of a universal medical cover will be pegged on increasing contribution of members to the National Hospital Insurance Fund. But in a quick rejoinder, the Federation of Kenyan Employers challenged Nyong'o to first match employees' contributions to NHIF and then increase funding for health to 15% of the national budget as outlined in the Abuja declaration ratified by the government of Kenya.
Keen to make the universal health insurance reality, Medical Services Minister Professor Anyang Nyong'o met with representatives of employers, civil servants, teachers, health workers and referral hospitals to build consensus on the now contentious issue of raising contributions to the National Hospital Insurance Fund. Nyong'o's message here was that government's allocation of 70 billion shillings to health is all there can be.
The Kenyan government has more or less reached a plateau today of budgetary allocation to healthcare. Don't try and milk the cow which does not have the fodder to feed on.
In Nyong'o's words, increasing contributions of members to NHIF will provide the push towards a universal cover that includes the unemployed.
Universal health coverage will enable Kenyans to have access to healthcare delivery in the private sector more than today.
But the Civil Servants Union expressed its opposition to the plan to cover all Kenyans based on contributions of the employed alone.
Because you cannot tax us to take care of the poor Kenyans. The health for Kenyans is the work for the Kenyan government.
Comments echoed by the Federation of Kenya Employers. FKE wants Nyong'o to first revoke the Gazette notice he published on the new NHIF rates, arguing it discriminates against the low-income earners.
Because the people who are outside the insurance scheme are the majority. So if those ones who are in are contributing a given proportion, then let the government come in and contribute double.
FKE further opposes a policy recently passed by Cabinet seeking to have employers match their employees' contributions to NHIF.
But to the extent that employers are going to continue to provide private insurance for their workers, then it will not be productive. It will add to the cost of doing business in this country for all employers to again contribute to the current scheme.
The Central Organization of Trade Unions, COTU, snubbed this consultative meeting. The National Referral Hospitals, however, asked the unions to consider the high cost of healthcare and come to an agreement with government soon. The Doctors and Teachers Unions KMPDU and KNUT also supported the plan for a universal cover, but asked government to first publish the findings of investigations into allegations of a scandal at NHIF.
Just calling all these groups here shows a lot of goodwill from NHIF, that they now want to consult stakeholders, they want to move forward.
Over the past few months, the National Hospital Insurance Fund has been the scene of intense boardroom wars that sometimes played out in the public. Now, even as this debate on a universal health cover continues, the different stakeholders do agree that Kenyans need this cover, but NHIF must first put its house in order. Anso Mwendia, KTN, Nairobi.